Our next speaker is Carolyn West Passarrello, who's a registered dietitian nutritionist, spokesperson for the Academy of Nutrition and Dietetics. Again, please read the full bios in your program guide. Carolyn?
Thank you. And since Leo did talk about his academy and the 67,000 folks that he represents, I'd just like to promote that our academy has 100,000 registered dietitian nutritionists. Not to say that's better, you're a subgroup of physicians, but I do represent 100,000 of us, of our dietitian nutritionists and nutrition professionals. So today, Dr. Parkinson, you mentioned, experiential learning is key, and I feel that that's very true. So if you'd bear with me, I'd like everyone to think about what you ate yesterday. As you're doing this, if you already know that you ate 6 servings of grains, could you stand up? So if you ate 6 servings of rice, pasta, bread, don't be shy, please stand up. Yep. Grains. Yes, grains. We'll get to that. Grains. So rice, pasta, any bread. Come on, there's not that many people on the keto diet in this room. All right. Any 6 servings? Servings are kind of small. If you had a big bowl of pasta, that could have been 3 or 4. So don't be shy. Stand up if you think you had 6 servings of grains. All right. Awesome, got a couple more. So now we might start to lose some people. Of those grains, were at least 3 whole grains? If so, stay standing. If they were not, could you sit down? So brown rice, whole wheat pasta, whole wheat bread, whole wheat tortillas. Awesome, we still have people standing. All right, so now, did you have 3, was your protein intake more plant-based than animal-based? If so, stay standing. If you had more animals than plants, please have a seat. Did you have at least 2 cups of fruit? Stay standing. And did you have at least 3 cups of vegetables? Stay standing. All right. Of those vegetables, did you have at least 3 different colors? Green, red, yellow, blue. All right. Awesome. So give a round of applause to these folks who have met the dietary guidelines. I know this is not a representative sample of the United States population, but this, even in a group of health-minded individuals, it's difficult to meet the goals that have been set forth for reasons that we've talked about here today. So today I want to share some more statistics on what we are eating, a little bit about what we should be eating, which you've heard a lot, but it does not hurt to hear it again, and a bit of what's being done to address the gap, but most importantly, some practical ways that you can personally apply the information. So as we saw in the room, along with many Americans, we're not meeting the dietary recommendations, which I don't believe is a surprise to anyone in here. The U.S. population has eating patterns that are low in vegetables, fruits, whole grains, dairy, seafood, all the things that we talk about that we want to be high in. And unfortunately, we are high, like the SAD, the standard American diet, is high in refined grains, added sugars, saturated fats, sodium, and for some groups, the proteins. So on this slide, you can just see how the percentage of Americans that aren't meeting the recommendations. I wanted to call out a few noteworthy statistics. So you can see on top, 87% of the United States population has intakes that fall below the goal for vegetables. So only 23% of us are meeting our goals. And what I don't think that was necessarily surprising. Does anybody know what the most commonly consumed vegetables are? There's 2 top. Potatoes and tomatoes. Why? French fries and ketchup. So even of that 23% that's meeting the recommendation, it comes with a lot of added things that we don't necessarily want. All right, so then 75% of us have intakes that are below what we need for fruit, and a third of that is coming from juice. So 2/3 of the fruit intake of the 25% that do meet it are having the canned, fresh, frozen, prepackaged, dried fruits. So we know most Americans urgently need to shift dietary patterns to achieve a healthy eating pattern. But luckily, young children and older adults are actually closer to the recommendations than our adolescents and young adults. So for some aspects of healthy eating patterns, if we just have the children maintain their intakes across the lifespan, there is a chance that we're going to see improved health outcomes. So it's great that our youth is doing better than most of us in this room. All right, so there was a study we talked a little bit about the world, what it's going to look like in 2050. So, we'll have an estimated global population of about 10 billion. There is a standard reference diet that it's going to take roughly 2,500 calories to feed the population at that point. And there's a lot in this paper about sustainability and how we're going to get there. And it marries both from the nutritional and the environmental aspect. So what I have here is the recommended state of the plate, again, towards 2050. So not far off from what we're recommending today. But what I did in pictures, now they're just one food. You probably, if you had your 6 grains yesterday, they probably weren't 6 slices of bread. They may have been. But so what is recommended to be eaten is 8 servings of grains, 1 cup of legumes, 3 tablespoons of oil, a cup of milk, a serving of nuts, 2 cups of fruit, 3 cups of veggies, a little bit of potatoes, and a little bit of protein, and no more than 7 teaspoons of added sugar. So again, everything that we've been talking about, mostly plants, a little bit of animals. But let's take a minute and compare that. So we've seen the statistics on what we're eating. What does it look like? So pictured on top is that reference diet, roughly 2,500 calories. Shown on the bottom left is a Chicago deep dish pizza, and on the right, Thai curry boneless wing meal. They both contain 2,500 calories each, not together. And that's just one meal for some folks. So, in today's obesogenic environment, the meal plan on top and being sure that our calories come with more than just a side of nutrition is going to take a lot more planning and preparation than those on the bottom. But like everyone has been saying, we need to make the healthy choice the accessible choice. Before we take a little bit closer look about how these foods are impacting our health more than we've already done, let's take a little sidestep and look more at processed foods, because they are what is currently more available for some, and we've talked a little bit about them. So I want to point out that processed foods, most of them should be consumed less often, but some can absolutely have a place in the diet. As we discuss processed foods and their environmental impact, we need to be sure that we are clear and aligned on the definition of processing and how we're determining these foods. So processed food is really anything that has been canned, cooked, frozen, packaged, changed in a nutritional composition, maybe by fortifying or preserving. Anytime we cook, we're processing foods, if we're cooking, baking, preparing foods. So processing is on a continuum from minimally processed, things like bagged spinach, pre-cut vegetables, things that are usually prepped for convenience. Then we move over to maybe not canned tomatoes anymore, but frozen fruit, also not canned tuna, the pouches perhaps, yogurt, so a little bit more processed. Then we get into ready-to-eat foods like crackers and granola. And then the most heavily processed foods are the pre-made meals, including like frozen pizzas, microwavable dinners, and those types of things. So there was also a study it was in the Journal of American Medical Association, and again, it looked at the French population, and it showed that there's an increase in higher mortality risk among middle-aged adults when they have an increase in ultra-processed food. So I think that's on the far right side. So when you hear processed food increases mortality, you really need to think about where on the continuum that is. And the authors did note that there needs to be more longer prospective cohort studies to really determine what it is, because there's so many variables involved in the processing and what that means. But just wanted to level set on processed foods a little bit. This is, again, nothing new, nothing that you haven't heard a few times yesterday and today. We have seen a shift from underconsumption and diseases of infection like smallpox and measles to diseases of unhealthy diets and overconsumption. So things like diabetes, cancer, cardiovascular disease. And that's why we're all here today, to talk about ways to combat that. This was also mentioned a little bit earlier on a slide. I just wanted to point it out again that it is possible to be overweight and undernourished. While we have an overconsumption problem, we have an undernutrition problem. So a person can easily gain weight eating the Chicago deep dish pizza, but they'll lose nutrient status. If the most affordable and available foods provide too many calories and too few nutrients, that's where we get this undernutrition and obesity paradox. So address this, we need to see a shift in our eating patterns. We need to focus more on nutrient density. And what is nutrient density if you're not sure? So on the left, I have a glass of milk, and on the right is soda or pop, whichever one you want to call it. They have similar caloric contents, 80 to 90 calories, but the milk is a better source of protein and micronutrients. So that makes it the nutrient-dense choice. The soda has calories but not much nutrition, so we call that the energy-dense choice. So we really need to shift. We talk a lot about plants versus animals. Another way of thinking about it is shifting to nutrient-dense choices so that we can maintain a healthy weight and meet our micronutrient needs. Now, I know easier said than done, but there is some work globally being done. The UN has a sustainable development goal. By 2030, will reduce 1/3 premature mortality from non-communicable diseases through this prevention treatment. And it marries everything that we've been talking about, the mental health, the well-being, the physical. And here in the United States, Healthy People 2020 has a goal to promote health and reduce chronic disease risk through consumption of healthy diets. And more interdisciplinary collaboration like this symposium are what is going to drive the needle forward and help all sectors, stimulate a variety of actions from individuals to organizations and really put everything that we're talking about into action. But if you have been thinking, you've heard that we need, as physicians, perhaps to take on these diets ourselves before we talk about them to our patients, or you want some resources to communicate these to your patients, you can start focusing on the plant-based diet, moving away from the westernized diet. The Mediterranean diet really is a great framework. You can also consider pescatarian, vegetarian, vegan. The health benefits of these diets are primarily from reduced consumption of the red meats and the sweets and the decrease in obesity, but it's also because of the increase in the fruits and the vegetables and the micronutrients. And as luck would have it, U.S. News and World Report ranked the Mediterranean diet the best overall diet and easiest to follow in 2019. So there's a lot of information out there on how to adopt the Mediterranean diet. There's a lot of registered dietitian nutritionists in the room that would love to work with you on adapting the Mediterranean diet. And what does that look like in food? It's, enjoying whole grains, fruits, vegetables, beans, herbs, spices, nuts, olive oil every day. About twice a week, you would have fish or seafood. You'd have a little bit moderate portions of protein, dairy, and eggs, and pretty infrequent consumption of meats and sweets. Old Ways, spt.org is a fantastic resource. They're kind of the owners of this Mediterranean diet pyramid. They also have guides like this for the vegetarian and the vegan diets, so I definitely encourage you to check that resource out if you have any questions on that. And I hope that I, provided you with a better understanding of our current diets, but more importantly, in this short time, provided you with some simple ways to make changes for yourself or your patients. Feel free, I have my contact information up here. If you have any questions after the panel today or after lunch, please let me know, and I'd love to chat with you.